Imagine getting ready for a very important event in your life, the arrival of a new baby. You've done everything right, gone to all your checkups, and your home is buzzing with excitement. But suddenly, you get the news you didn't see coming. You have gestational diabetes. How will this change your pregnancy, and what does it mean for your baby's health? What is gestational diabetes? Gestational diabetes mellitus, often simply known as gestational diabetes, occurs when a woman who didn't previously have diabetes develops high blood sugar levels during pregnancy. This condition arises because hormonal changes during pregnancy can lead to insulin resistance, where the body's cells do not use insulin as well as they should. Insulin is the hormone that helps glucose move from your blood into your cells for energy. During pregnancy, your body needs more insulin, but if it can't produce enough, the result is gestational diabetes. Unlike type 1 or type 2 diabetes, gestational diabetes is specifically tied to the changes and demands of pregnancy. It usually develops in the second or third trimester and often disappears after giving birth. However, it's important to note that women who have had gestational diabetes have a higher risk of developing type 2 diabetes later in life. Causes and risk factors. The exact cause of gestational diabetes is not entirely understood, but it's believed to be related to hormonal changes during pregnancy that affect insulin's ability to work properly. The placenta produces hormones that make a pregnant woman's cells less sensitive to the effects of insulin, which can lead to high blood sugar levels. Several risk factors can increase a woman's chances of developing gestational diabetes, including being overweight or obese before pregnancy, having a family history of diabetes, being older than 25 years during pregnancy, having had gestational diabetes in a previous pregnancy, being of African American, Hispanic Latino, Native American, Asian American, or Pacific Islander descent. Understanding these risk factors can help in early diagnosis and management, significantly improving outcomes for both mother and baby. Symptoms and diagnosis. Gestational diabetes often does not have clear symptoms, which is why screening during pregnancy is critical. However, some women may experience unusual thirst, frequent urination, fatigue, or snoring. These symptoms should prompt immediate discussion with a healthcare provider. Diagnosis is usually made through a glucose screening test, typically conducted between the 24th and 28th weeks of pregnancy. If high sugar levels are detected, a follow-up glucose tolerance test is performed to confirm gestational diabetes. Effects on pregnancy and the baby. Gestational diabetes can have significant implications for both the mother and her baby if not properly managed. Understanding these effects highlights the importance of early detection and diligent management of the condition. For the pregnancy, 1. High birth weight. One of the most common effects of gestational diabetes is macrosomia, where the baby grows too large, typically over 9 pounds. This occurs because excess glucose in the mother's bloodstream crosses the placenta, leading to higher insulin production in the baby and subsequently more fat storage. A larger baby increases the risk of injury during delivery, both for the mother and the baby, and often necessitates a cesarean section. 2. Preterm birth and respiratory distress. Syndrome. Gestational diabetes may increase the risk of premature birth, which can lead to respiratory distress syndrome, a condition that makes it difficult for the baby to breathe. While it can be treated, premature babies may need help breathing until their lungs mature. 3. Preeclampsia. Women with gestational diabetes are at a higher risk of developing preeclampsia, a serious blood pressure condition that can threaten the lives of both the mother and the baby. Preeclampsia can lead to complications such as eclampsia, seizures in the mother, and the necessity for early delivery. For the baby, Number 1. Hyperglycemia. Babies born to mothers with gestational diabetes are at risk of hyperglycemia, low blood sugar, shortly after birth due to their own insulin production being high in response to the mother's high blood sugar levels. This condition can cause seizures in the baby and requires immediate treatment to raise the blood sugar levels. Number 2. Jaundice. Jaundice is more common in babies of mothers who have gestational diabetes. It's a condition where the baby's skin and whites of the eyes turn yellow due to a high level of bilirubin, a yellowish pigment of red blood cells. Number 3. Development of type 2. Diabetes. Children born to mothers with gestational diabetes have a higher risk of developing obesity and type 2 diabetes later in life. This highlights the importance of maintaining a healthy lifestyle and regular monitoring for these children. Number 4. Stillbirth. Although rare, unmanaged gestational diabetes increases the risk of stillbirth, proper management of gestational diabetes significantly reduces this risk. Long-term health concerns. Managing gestational diabetes effectively can mitigate these risks, ensuring a healthier outcome for both mother and baby. After birth, mothers need to continue monitoring their glucose levels and maintain a healthy lifestyle, as gestational diabetes increases their risk of developing type 2 diabetes in the future. Children born to mothers with gestational diabetes should also be monitored for signs of diabetes and obesity as they grow. Management and treatment of gestational diabetes. Managing gestational diabetes effectively is paramount for the health of both the mother and the baby. It involves a multifaceted approach that includes lifestyle modifications, monitoring blood glucose levels, and, if necessary, medication. The goal is to maintain blood glucose levels within a target range as recommended by healthcare providers. Lifestyle modifications. In lifestyle modifications, the main components are dietary changes, physical activity, monitoring, etc. Let us discuss each of these one by one. Dietary changes. A key component in managing gestational diabetes is making informed dietary choices. This involves carbohydrate management. Understanding how different foods affect blood sugar levels is crucial. A dietitian can help create a meal plan that spreads carbohydrate intake evenly throughout the day to prevent spikes in blood glucose. Healthy eating patterns, incorporating a variety of nutrients and foods, including vegetables, whole grains, lean proteins, and healthy fats, into daily meals. Portion control. Eating moderate portion sizes to help manage blood sugar levels and support healthy pregnancy weight gain. Physical activity. Regular physical activity can significantly improve blood glucose control. Recommendations for pregnant women include at least 150 minutes per week of moderate intensity aerobic activity, such as brisk walking. Incorporating strength training exercises at least 2 days a week if there are no other health conditions or pregnancy complications that would contraindicate these activities. It's important for women with gestational diabetes to consult their healthcare provider before starting or modifying their exercise routines. Blood glucose monitoring. Frequent monitoring. Women with gestational diabetes are often advised to monitor their blood glucose levels 4 or more times a day, including fasting and after meals. This helps in making immediate adjustments to diet and activity levels. Keeping records, maintaining a log of blood glucose readings, dietary intake, and physical activity can help healthcare providers make necessary adjustments to the management plan. Medication and insulin therapy. Medication. If lifestyle modifications are insufficient to control blood sugar levels, medications such as metformin or glyburide may be prescribed. Insulin therapy. Some women may need insulin injections to maintain their blood glucose levels within the target range. The type and amount of insulin are carefully determined by healthcare providers. Ongoing medical care. Regular checkups. Frequent consultations with healthcare providers are essential to monitor the health of the mother and the development of the baby. This may include more frequent ultrasounds or non-stress tests to monitor the baby's well-being. Postpartum care. After delivery, blood glucose levels usually return to normal. However, women who had gestational diabetes should have their glucose levels checked at their postpartum checkup and at least every 3 years thereafter. They should also be counseled on lifestyle modifications to reduce the risk of developing type 2 diabetes in the future. Education and support. Diabetes. Education. Participating in a diabetes education program can provide valuable information and support for managing gestational diabetes. Support groups. Joining a support group for pregnant women with gestational diabetes can provide emotional support and share experiences and tips. Prevention and post-pregnancy care. While gestational diabetes cannot always be prevented, some measures can significantly reduce the risk and help manage the condition if it develops. Equally important is the care after pregnancy, as gestational diabetes increases the risk of developing type 2 diabetes later in life. Here's a closer look at strategies for prevention and post-pregnancy care. Prevention strategies. Number 1. Healthy weight before pregnancy. Achieving a healthy weight before pregnancy can reduce the risk of gestational diabetes. A balanced diet and regular physical activity are key to maintaining a healthy weight. Number 2. Nutritional diet. Eating a well-balanced diet, rich in fruits, vegetables, whole grains, and lean proteins, can help manage weight and regulate blood sugar levels. Limiting processed foods, sugary snacks, and beverages can also play a crucial role in prevention. Number 3. Regular exercise. Regular moderate-intensity exercise before and during pregnancy can help improve insulin sensitivity. This means the body can use insulin more effectively, reducing the risk of gestational diabetes. Aim for at least 150 minutes of moderate aerobic activity per week, as recommended by health authorities. Number 4. Monitor blood sugar levels. For those at high risk of gestational diabetes, monitoring blood sugar levels even before becoming pregnant can provide valuable insights and help in taking early action if needed. Number 5. Consult healthcare providers. Regular appointments with healthcare providers can help identify risk factors early. They can offer personalized advice and monitoring plans to mitigate the risk of gestational diabetes. Post-pregnancy care. Number 1. Postpartum screening. Women who have had gestational diabetes should undergo glucose testing 6 to 12 weeks after giving birth to check for type 2 diabetes or prediabetes. Regular follow-up tests are recommended as the risk of developing diabetes remains higher throughout life. Number 2. Healthy lifestyle. Continuing with a healthy lifestyle after pregnancy is crucial. Maintaining a balanced diet and regular exercise can help manage weight and blood sugar levels, significantly reducing the risk of type 2 diabetes. Number 3. Breastfeeding. If possible, breastfeeding is encouraged as it can offer health benefits for both mother and baby. For mothers, it may help with weight loss after pregnancy and lower blood sugar levels. For babies, it can reduce the risk of obesity and diabetes later in life. Number 4. Family planning. For future pregnancies, early consultation with healthcare providers is essential. They can assess the risk of gestational diabetes reoccurring and provide guidance on preventive measures. Number 5. Education and support. Joining support groups or educational programs focusing on gestational diabetes can provide valuable information and emotional support. Sharing experiences and strategies with others who have faced similar challenges can be empowering and informative. Gestational diabetes is a condition that, with early diagnosis and proper management, can be effectively managed to ensure the health and well-being of both mother and baby. Awareness and understanding of this condition are vital for pregnant women and their families. With the right care and lifestyle adjustments, women with gestational diabetes can have healthy pregnancies and healthy babies. Thank you for joining me on this insightful journey. If you found this information valuable, don't forget to like, share, and subscribe. If you have any questions or topics you'd like us to explore in future episodes, leave a comment below. Until next time, stay vigilant and stay healthy.